All right, about a third of South Africa's population is missing out on basic private healthcare services. That's according to the Board of Healthcare Funders. They're blaming this on delays in developing a framework for low-cost benefits. To discuss this further, I'm joined by the Board of Healthcare Funders Managing Director, Dr. Katlego Mothudi. Doc, thank you very much for your time here on eNCA. I understand that you've been calling for these LBOs to be discussed since 2016. What's the delay?
Good morning, Masiko, and thanks for having us. Just maybe for those who are not aware, there has been a regulation that was passed in 2016, which is called the Demarcation Regulation, which states that no entity other than medical schemes should conduct the business of medical schemes. This was so declared because at that time, there were quite a number of these products that were deemed to be preferably should have been housed in schemes, but were offered by other entities. Now, what was then declared at that time is that the Council for Medical Schemes, in assistance to the Department of Health, was supposed to craft a framework that would allow the migration of those people and policyholders that already have these products to then move into the medical aid environment. And that is a delay. And 5 years later, the framework is still not finalized. And that's why we have been making these calls that this should be fast-tracked.
So how has this, further burdened the public healthcare system, this delay?
So if you look at the coverage of for healthcare services, medical aids cover just under 9 million people. Now, in a population of about 60 million or so, we're saying that about 51 million people are under the stewardship of the National Department and the various provinces. I think all of us are aware of the various challenges we've had of budget cuts, and this from the department itself. That makes it unaffordable or them unable to actually cater for the population that it's supposed to take care of. You hear of the departments and hospitals not being able to provide posts for interns and doctors, etc. You've also seen statistics that shows that employment of clinicians is actually skewed towards the private sector in terms of the ratios. So obviously the state is under a huge burden, and it's only going to worsen as we project, also because there are budget cuts that are looming for the state. So it means that the 51 million people that should be looked after by the state remain at risk for not having access to healthcare services. We do estimate that almost immediately between 10 and 20 million people, if the Council for Medical Schemes could start allowing schemes to offer these products, could actually find access through the products. And just of interest, Masiko, it is not like people are not using the private sector, but they are using their own money to pay for these services. A few reports, even from Stats SA, indicate that up to about 48% of households indicate that at least one of their members purchases services from the private sector. And up to about, I think, 22% of people use the private sector as a point of care. And this is in comparison to the 15% of the population that is on medical aid. So we're just saying that people need the services, they're already paying out of pocket. It's better that this is formalized through the medical schemes, and it will actually be a better environment for them to purchase the services for.
Yeah, and I would have thought that, putting that act that was actually discussed since 2016, or the law that's supposed to be implemented since 2016 pertaining to LCBOs, is something that would benefit the National Health Insurance Plan, right? Because of the fact that at the moment, if I'm on medical aid and I go to a private institution and I find out that something I can get for free in the public sector is way more money in the public sector or the private sector, I'll probably go to the public sector so that I save money, but then I overburdened the public sector as well. So doesn't this, the implementation or the fast tracking of the implementation of this act that was discussed in 2016 also benefit NHI?
It would, and just to relook at the principles of universal health care. You want to make sure that there's access to essential services that are affordable and of good quality without much financial hardship. So obviously access is already compromised, because if you're going to go to the clinic or to the hospital, there are backlogs. You've heard of waiting periods, some queues, up to about 4 years for certain procedures, etc. So there are some resources that are available in the private sector that will actually alleviate the burden. The second area is that these products actually focus on primary healthcare services and preventative healthcare, which is actually the bedrock of universal health coverage. And we're saying that instead of people queuing for hours, sometimes days, at facilities where there are no medicine, sometimes personnel to look after them, there is some capacity in the private sector that could alleviate the burden. In the department's own words, implementation of NHI is not going to be tomorrow, and they are even estimated it's going to be for another 10 years or so. So what we're saying is that while that process is actually going on, there could be access that is provided to people that cannot have this access. Furthermore, we will be able to then generate that data that the department and the NHI could actually use in developing appropriate benefit packages when NHI is eventually implemented.
Thank you so much, Doc, for speaking to us here on eNCA.